And a fistula is considered a longer-term solution for dialysis. And what a fistula is it's a surgically created connection between the artery and vein, most commonly placed in someone's arm, but they can also be placed elsewhere. It really depends on just having adequate inflow through an artery and adequate venous return through a vein. For a fistula to be placed, you need to have healthy vessels to do this. So the ideal setting, of course, is using the patient's artery and their vein, but when an inadequate vein exists, sometimes surgeons will place a graft to serve the purpose of connecting the artery with a larger vein centrally. But the fistula is a circuit that's created in the patient where basically the high pressure, high velocity blood that travels through the arteries is shunted immediately into the vein. So you basically get this blood circuit that's brought close to the skin and it's easily accessible. We do those procedures called a fistulagram in our office. Again, this is an outpatient procedure. We do it non-surgically, simply by accessing the fistular graft with typically one or perhaps two sites of access into the fistula. It depends on what the problem may be. We study the fistular graft by injecting a dye that shows up on live x-ray. And what we're looking for is we're assessing the blood flow through that circuit. We're making sure there's no competing circuits, or in other words, veins that are taking blood flow away from the fistula that shouldn't be. We're looking for areas that are narrowed. We're looking for blockages, and we repair them. And the repair of this, for the most part, is quite simple. It involves getting a catheter and a wire through an area that is either narrowed or blocked, and then repairing it. And to repair it over a wire, you can deliver things like a balloon, which stretches that lumen back open. But maintaining the function of a dialysis fistula or graft is imperative, and we try very hard by our relationships with the local dialysis centers to ideally catch fistulas before they clot off. And that's accomplished during dialysis. They're monitoring things such as the pressure inside of the fistula, the flow rates inside of the fistula. Are they having difficulty getting inside of the fistula? And so it's that communication that we have with the dialysis center that we really try to keep very strong, because we see the care of these patients as equally our responsibility as theirs, and it's that partnership that I think leads to excellent patient care.